I've been in very good health most of my life. This Parkinson's started maybe about 13 or 14 years ago. It started out simply with the leg tremor, and then it went to the other leg, then it went to the arms. It is a kind of a strange thing because sometimes you're feeling so well, and other times it's just like a little bit of this movement kind of thing that you have no control over, or what we call freezing, where my brain says to my feet, walk, and they won't move. You know, you just can't get yourself going.
She's not a complainer. You know that the discomfort, the pain, the limitations are there, pretty obvious, but you don't hear her complaining.
From the day I met Ann, she came in with Parkinson's disease as her initial complaint, and from day one we handled all of her non-Parkinson's issues that impacted her life, from mobility and activities of daily living to pain. And it was clear when I first met her that there were a whole lot of other things that we had to address that were affecting her Parkinson's, and that was a secondary issue initially.
Just about everybody we go to, except our family doctor. He does not accept Medicare, but we've known that since the beginning, since we started going to him. And usually that's one of the first things you ask a new doctor is, do they accept Medicare? And we have always seemed to have doctors that have accepted it, which has worked out very nicely, because I have had to go over these last few years all of a sudden to many doctors, because of age and the various things that happen to you when you get older.
My group left Medicaid about 6 or 7 years ago because we couldn't take care of patients adequately, so we felt uncomfortable in the system, and the reimbursement was such that it actually was costing us more to see the patients than if, being a Medicaid provider, than if we just didn't take them when we saw them for free, should they be in the hospital. As the Medicare population grows, the initial thing you're going to start seeing is we're going to be able to provide less and less services. So at some point we're going to have to let people go, and then when it gets too much where we can't afford to pay everybody and pay electricity, etc., we'll have to stop seeing Medicare.
There are things going on now with Parkinson's that weren't going on 10 years ago. Yet if something comes up and it's a good thing, you feel like you should take advantage of whatever it is the doctors recommend.
So now you have an interaction where the patient comes to see a doctor. The doctor is bound by federal law to follow protocols set forth in Washington, D.C. Deviation can be punished, and how they're going to punish is very hard to figure out. My reputation now is built on taking good care of patients. In the future, my reputation is going to be whether I stick to protocols. We know for a fact, first of all, that we've cut $500 billion from Medicare. So $500 billion, or half of the cost of the health care bill, is coming from deductions from the seniors. Patients like Ann will have to be spending a lot more of their own personal money to pay for medications that are not on the Medicare formulary. Some of my patients have that kind of money, some of my patients do not. So I'm all for reform that puts the patient in charge, gives patients access to all the doctors, and reduces costs, and we got the opposite in Obamacare.